สวัสดีค่ะ
สวัสดีครับ
สวัสดีค่ะ Dr. Wechat. Could you give us the big picture of the prevalence of the HIV situation in Thailand?
As a matter of fact, we have seen HIV epidemics in Thailand for about 15 to 20 years. And initially, we had such a big epidemic. We had new infections per year. It was 150,000 new infections per year. At that time, it was real critical time of Thailand. But Thai government and civil society has done such a remarkable job in prevention of new infections, and we've seen a gradual decrease of new HIV infections over time. Like last year in 2016, the new infections of HIV in the entire country, it's about a little bit over 6,000 cases per year, and that's, I think that's a remarkable job that we have done together, right? But however, having said that, there are some subpopulation or subgroups of people that are still at a very high risk of new infections, and these are people who, what we call MSM, or men who have sex with men, or transgender people. We've seen an increasing, not decreasing, an increasing new infections in this group of MSM or transgender people.
Can you tell us the reason behind the increase between among this group?
Yeah, you know what? In general population, the uptake of condom use has been quite well, but the condom use reportedly from the official report for MSM and TG has been quite well 80%, but in practical, in real life, when we see patients, we've seen examples of people not using condoms. So behavioral risk is definitely there. It's a risk factor for this group, and the condom use is actually not adequate. I would say 50 to 60%. And another important driver, which not many government agencies has addressed adequately, is substance use. And this, I mean alcohol use and also ice or amphetamine use. Because once you drink alcohol or using amphetamines, then you tend to increase the risk of sexual behavior, not using condom, multiple sexual partner. People can have, party and sex for 48 hours non-stop, and I think those are the big drivers. And having said that MSM is a particular risk group, right? But the one disturbing fact for me is that the younger MSM are the one that actually poses the highest risk of HIV infection among all. So if you compare MSM who are 30 years old and younger versus 35 years old and older, the younger ones have at least 2 times risk factors for HIV infection compared to the older population.
Well, what would be your suggestions in order to tackle such issue?
Yeah, there are many things. Obviously we need to do a lot of prevention work, right? But there is one very important gateway, and that is to get all MSM or any population who feel that they are at risk of HIV infection to come for HIV testing. So this is the blood test, which is very friendly. You can come in and can get the blood test, and the results in 20 minutes. It's one day, same day result, a rapid test. And by testing your blood, and knowing whether you are infected or not infected has big implication. Let's say if I come in and I test myself, if I have HIV infection, then I will go on to get the HIV treatment, right? If I test myself and then I don't have HIV infection, then I go on to get some prevention services, which is now available. We're now talking about HIV treatment. If I have HIV infection and I treat myself until the viral load or HIV virus in your system is not detectable, it's completely suppressed.
Is that considered cured?
It's not a cure, but it's a maximal treatment goal, for having HIV virus less than detectable in your blood. your chance of transmitting the virus to others is 96% less versus if you don't treat yourself. Right? If you don't have HIV infection by blood test, then you will go on taking, for instance, using consistent condom use, get counseling from providers, or taking what we call PrEP or pre-exposure prophylaxis. And pre-exposure prophylaxis is taking 1 tablet a day of medication. It will protect you over 97% from HIV. So therefore, if you can get as many people to come for HIV testing, the ones that are positive get treated, the ones that are negative get prevented, then the HIV epidemic, so new infections will be a lot less.
Bangkok Health Hub, together with Siriraj Hospital, is offering the HIV screening test for 500 men who have sex with men, or MSM. Could you tell us more about this project?
Sure, so this is an important gateway, like I just mentioned, that by having people come for HIV testing is so beneficial. So we, as Bangkok Health Hub, we are the clinic in Silom area, and we work with Siriraj Hospital, and also Thailand US CDC offers free HIV testing to MSM, men who have sex with men, transgender, of any professions, of any nationalities. You can be Thai, you can be non-Thais, you can be migrant workers from Myanmar, for instance, and you can get HIV testing for free, 500 cases. So, this is going to be a very interesting project that if we can get more and more people into testing, then we can tackle this HIV epidemics much better.
And for those who want to join in this project, how would you contact, or is there any qualification for they to submit before they come in?
Yeah, we like to focus on, like I said, men who have sex with men of any nationality, 30 years old or younger. If you are above 30 years old, it's still okay to get tested, but we like to focus on the 30 years old and younger. If you're interested in this free HIV testing, you can go on to Facebook and you just search for Bangkok Health Hub. Okay, that's the Facebook. Or you can go to our website, www.bangkokhealthhub.com. Or the number is 026328232 or 086-377-8171. We are open from noon to 8 p.m. every day except Sunday.
For those who didn't make it to the first 500 people of this project, what should they do and where should they obtain the HIV test?
Well, basically, beyond 500 cases, it would not be for free, right? I mean, you can still come and get tested. But to be honest with you, if we can get 500 cases on board, maybe we can ask for more funding from the government to expand the free HIV testing to 1,000. So the more you come in, then the more you can give out the free HIV testing to your friends and colleagues. So if you know anyone who qualify being MSM, any age, but preferably 30 years old or younger, then please come into Bangkok Health Hub for free HIV testing. The more, the better.
Okay, thank you very much, Dr. Pachara, for such insightful information.
My pleasure.
สวัสดีค่ะ
สวัสดีครับ